Hello, social media land. It's Dr. McDonald here. Thanks for joining us with another PermanenteDocs Chat. So today we are going to talk about the COVID-19 pandemic and physician mental health, which is obviously a huge topic. I'm sure you've seen lots of this in the news and other things. And we have one of my personal favorite psychiatrists here to talk with us today. Full disclosure, she's married to me and she has to put up with me at home as well as here on social media. So thank you, Dr. Zucker, for joining us. Please just tell us who you are and what you do, and we'll jump right in.
Sure. So I am Alex's better half. Let's be honest. No, but in all reality, he's an excellent half. So I'm the chief of psychiatry here in San Bernardino County. I wear a couple of other hats as well. I'm also an elected board member to our board of directors. I serve on our regional team for medical certification, and I'm also the regional lead for child psychiatry. It's not necessarily a hat, but I've been involved in our Rise and Renew project, working specifically towards mental health training for both our physicians and our physician leaders. So thank you for having me.
No, thanks for joining. I deal with me at home and here, so kudos to you. Well, so let's jump right. So tell me what you're hearing from our colleagues across the area, across the region, with how they're coping with the stress and the burnout for nearly two years now of COVID-19 pandemic.
Yeah, I mean, I think the things that we're hearing have really morphed over time. I remember early on in the pandemic, it was just the fear, the anxiety, the unknown. We talked at home even about just how horrible it felt to not know if you were providing the right care to your patients. Were you doing the right thing? I think it was very overwhelming. It was also, you couldn't leave work at work. COVID was everywhere. So you were at work, dealing with patients, whether you were treating COVID patients or not. It was sort of the constant, topic of conversation. And then you go home and then you're worried about your family members, your kids, your parents, your significant others. Physicians were sleeping in garages and, all sorts of things. So that was just, incredibly stressful. And it's not that I think it's any less stressful now. I think it's just morphed over time as to what that stressor is. I think a huge part of it is that this just feels like it never ends. It's sort of wave after wave. And, our physicians have been all, no matter who they are, what department, what specialty, they've all been working so incredibly hard, day in and day out before the past 2 years, but certainly in the past 2 years. One thing I'm hearing a lot most recently that people are really struggling with, especially our inpatient physicians and our ICU physicians, is really just some struggles with how they're being treated, to be, completely honest. Unfortunately, COVID has created a lot of, divisiveness in our society, and we're seeing that kind of play out in our workplace. And as physicians, we're here to help and to treat anyone, no matter, where they come from, who they are, what they believe. But yet our physicians are being attacked, sometimes literally, because of what's happening. And so to me, that's probably the worst thing to be hearing about right now. Again, I don't know that everybody is necessarily having that stressor sort of front and center, but I think we're also all worried about each other. And that's a huge stress, right? We are caring, compassionate people, and we worry not usually about ourselves. We usually don't worry about ourselves. We usually worry about everybody else. And that's a lot of weight to bear. So, that's just skimming the surface. There's lots of other stuff in that question.
Yeah, no, I can relate to every single thing you just said, both personally and professionally. And I think that was a great summation. I can just, from personal experience, as you know, but more for our viewers out there, back in April of 2000, when this COVID pandemic was first here, I had a patient who I felt a lot of that stress in the hospital, not knowing if this truly was COVID or not, how to treat them, what to do, whether I was making a mistake, and that really weighed on me, not just during work. I took a lot of that stress home and I didn't sleep well. I was thinking about that overnight as well too. So I think so many things you just talked about are I have personally experienced as well too, doing family medicine in the hospital and clinic too. There's a variety of ways that we have been impacted. But we could probably do an hour on that topic alone here, but we're going to try and keep this
probably several.
Yeah, that's true. Well, and so now, as many people know, I just got COVID. We both just got COVID about 2 or 3 weeks ago. Obviously, as physicians, as you said, we can't leave this at work, and we bring it home with us, both literally if we get contract COVID, and then also just kind of the emotional stress of that and caring for kids at home too. So, what tell us more about, from your perspective, what you're hearing other colleagues talk about in terms of when they contract COVID themselves, what additional stress that does that put on the physician in our area or across the area?
Yeah, well, I mean, I can certainly speak to some of the things you told me about how it made you feel, but I think for physicians who, of course, people, along the way have contracted COVID, but for us, we made it almost 2 years without COVID, and so I think, to some degree, it felt like you had failed at something because you
Mhm.
got COVID. And I told you, then I'll tell you again, you didn't fail at anything. We can do our absolute best, and any one of us can still get COVID. And I think, something that's really important to keep in mind for this topic, but for a lot of other things, is that, we can only control so much. As human beings, we want to control everything. And certainly, our anxiety makes us want to control everything, but we can't. And so to really focus on what are the things that we can control. So we can, put forth all the efforts to not get COVID, wear a mask, wash our hands, socially distance, all of those things, and
Get
it can still
vaccinated.
happen. What?
Sorry, get vaccinated.
Get vaccinated. Sorry, thank you.
Important one.
And boosted. Um, definitely. But also thinking about, all right, well, now I have COVID. What do I do? What can I control? Right. So I can keep wearing my mask. I can, isolate myself, from other people so that I don't contract COVID. We were very fortunate. Our kids didn't, contract COVID, but we were also cautious, right? We were wearing masks at home, and, our little guy was constantly trying to cuddle, and it was really, really hard, but saying it's really, you have to stay away. It's really for your, best interest. And so sometimes just bringing yourself back into a position where you can control something can certainly make you feel better. But I think it's really hard to just kind of let go of that guilt that comes with it, certainly. But, again, didn't do anything wrong. Any one of us can and probably will get COVID. But if you are vaccinated and boosted, hopefully it won't be that bad.
Yep, exactly. I think that's the most important thing that I've been always telling my patients and encouraging my peers. Every time you see a patient who's not vaccinated or boosted, just be like, "Hey, you should get your vaccine. Hey, you should get your booster," because that can make a difference between being stuck at home or in the hospital for weeks, or like we had. We were home for 7 days with kind of a stuffy nose and a headache. And so the vaccines worked really well, and that's, I think, the most important thing. I would be remiss if I didn't at least give that point based on how passionate I am about vaccines and preventative health too. Um, well, so as you mentioned, we're still, we don't know where we are in this pandemic. It's been 2 years. We're now kind of, Omicron is still here, but we seem to be on the down slope of the Omicron surge. What can physicians do just to kind of deal with this ongoing pandemic and prepare for what's likely going to be a next surge? When and where, we don't know.
Yeah, I mean, I think it goes back to, what I just commented on in terms of focus on the things that you can control. The uncertainty is very, very unsettling. And so that's very hard to manage. I think sometimes it's about taking it one day at a time. We don't know when this will end, what this will look like. And if we try to predict, that can sometimes be more frustrating because, we thought, oh, we're going to be, out of school, out of work, or whatever it might be for a couple of weeks. And here we are 2 years later, right? So I think also just setting yourself some reasonable expectations is important, and just taking it sort of one step at a time. I don't know that we can do all that much more. But I think what's also incredibly important for our physician colleagues to hear is that, we don't know when this is going to end, and we are all exhausted, right? And we are at the end, we're burnt out, we're really struggling day by day. And so it is so incredibly important that we take care of ourselves. We take our time off when we're supposed to take time off, even if it's not safe to go anywhere, just take time off to just step away from work for a little while is incredibly important. I tell folks too, like even 5 minutes a day of your own time can do wonders, right? So really making sure that we're not forgetting ourselves and putting ourselves first, because we often put ourselves last, especially as physicians.
Yeah, no, that kind of segues very nicely into my next question here in terms of just some practical tips that physicians can do to sort of maintain their own mental health. And I think you kind of answered that pretty well already in terms of just, medicine was hard before, and now it's even harder. One thing that I really always tell my colleagues to do is to build relationships and to reach out to people at work too, and just to sort of have some sense of collegiality. It's very easy as a physician to go to work, do your job, and go home, and just stay in your office or kind of stay sitting in front of the computer and not having any interaction with your colleagues as well too. So it's hard to know if someone's struggling if someone's just sort of isolated the whole time as well. So I think trying to stay connected with your colleagues and support one another, like you said, is so important. Are there any other practical tips you would offer our physicians to maintain their mental health during this time?
Yeah, I mean, I think there's certainly some obvious things. I think one thing I just want to comment on with what you just said too is that not just staying connected to people, but I think talking about what we're experiencing and what we're feeling is incredibly important. There's a lot of stigma associated with mental health. Certainly a lot of stigma for physicians to just keep their head down, do their job, don't admit any weakness, right?
Mm-hmm.
But we're all human beings. We all struggle from time to time. We've got good days, we've got bad days. And, you're often surprised. You say like, hey, I had this experience, or, I just had to deal with this. It was really difficult. How many other people will say, I did too. Thank you for saying that. Right. And so the more that we really encourage each other to talk about it and serve as our own role models, right, to talk about these things, or talk about how, oh, today was really tough, or, I was so frustrated, whatever it might be, is really, really important. I'll try not to go off on a tangent, but there's a ton of research out there that really supports that the most important thing a leader can do, and as physicians, we are all leaders, is to talk about mental health. And that doesn't mean you have to disclose, your full mental health history, or, your doctor's name and address, or whatever it might be. But
please don't actually.
Right, don't do that. But to be able to say like, this is what I do to take care of myself. Or yesterday was really rough, so I put my phone away, I put my computer away, my in basket's a mess, but I just sat down and had dinner with my family. Really just saying other things that that you're doing for yourself, and just sort of reflecting on the concept of mental health really brings that conversation to the forefront and normalizes having those conversations. So that's incredibly powerful. The other things that I would say, just in terms of, tips for physicians, is again, carve out that time for yourself. It doesn't have to be some, huge production, or it's not like you've got to spend $1 million for, a spa day in the, Turks and Caicos or whatever, right? It can literally be, 5 minutes listening to your favorite song, or 5 minutes just taking a, warm shower, whatever it might be. And so carving out that time and whatever works for you. I think sometimes mental health, wellness, that topic gets a little bit of a bad rap. Everyone thinks they're going to be told, well, do some yoga, here's some free pizza, right? Like, we know that stuff's not actually what makes us feel better, but what makes us feel better is very individualized. And so identifying what works for you and what helps you is very, very important.
I once did an activity at a meeting where everyone was given a toothbrush. Don't worry, it was a clean toothbrush. And they were told how to brush your teeth. Okay, do the top back and forth, now up and down. And it was very like prescripted in terms of how you brush your teeth. And it felt so awkward because we all do brush our teeth. We all just do it second nature, but we have a way that we do it. And that was the connection to mental health and to wellness, right? We all need to do our own mental health and our wellness, but it's different for everybody, and everyone can't do the same thing. So your comments there just made me thought about that activity. So maybe we'll get toothbrushes for our next PermanenteDocs Chat here and share them with everyone listening. No, I'm teasing. I do want to reflect on one thing you just said here in terms of just talking about your feelings and talking about your experience. That very challenging patient I had back in March or April of 2020, when this pandemic first began, I actually wrote a blog post about that experience. And I'm not really much of a blogger. I'm a talker, as you know, but I actually wrote down kind of some of the thoughts and feelings, and that was such a cathartic experience for me. And I was really amazed at how helpful that was to help me sort of process that and share it with others as well. It was a little scary, obviously, but for someone, that's not something I typically did, and by doing that, that was immensely beneficial for me as well too. So I wanted to kind of share that concrete example of what you were talking about before. Um, what are your own personal habits to maintain your own personal mental health? I know we just talked about everyone's unique, but what do you find that works well for you besides ignoring me?
Well, the things I can talk about publicly. No, I'm just teasing. Well, I know you know what I do, but I'll tell everybody else. Well, full disclosure, we're both Peloton addicts. So using our
Sure.
Peloton, both the bike and the tread, and just exercise in general is a huge, stress reliever. Certainly, I don't feel right if I haven't exercised for the day. So that's exceptionally important to me for my well-being. The other thing, which, I even tease myself about is I have to watch TV every day. And sometimes there's not time for it, and then I'm very sad, or I just make time anyway. But to me, that's a way to sort of decompress, kind of, probably remove myself a little bit from reality and just kind of escape for a little bit of time. I also just love entertainment in general. So, it's meaningful to me to kind of connect with something, outside of medicine and outside of work. So those are probably my top two. There's lots more. I love to bake, but with COVID, it's much harder to feed people. So that hasn't been happening as much. So fortunately, you haven't had to do quite as many dishes, but
And that's the one silver lining of this pandemic, I guess. But anyway, I digress. Um, So tell us, what are some symptoms that physicians may be experiencing themselves, or we may see in a colleague that should trigger us to take action or seek help? I think that's a really big thing. As you mentioned, we tend just to focus on others and we forget about our own mental health. What are the signs and symptoms that we should either seek help ourselves, or a colleague may see that should encourage us to seek help for a colleague or reach out to a colleague as well?
yeah, absolutely. Probably the biggest kind of red flag is for just a change in kind of baseline behavior, right? So someone who maybe is really involved, super outgoing, all of a sudden isn't really showing up for meetings or just isn't as engaged, right? And they just seem like they're not their sort of usual self. That can often be an indication that they're struggling in some capacity. If people are, not necessarily doing the work they used to do, or not doing it as well as they used to do, for example. So sometimes like performance type stuff, can be an indication that someone's struggling. Other, red flags can be things like changes in sleep, either more or less sleep. Certainly increased substance abuse is a red flag and has definitely been an issue throughout COVID for many, many people. And so if you're noticing that for yourself or for others, that can be concerning too. If people just seem, more down, sad, or irritable, right? Sometimes people don't recognize that irritability can be a symptom of both anxiety and depression. And so if people are just quick tempered, quick to get angry or frustrated, that can be an indication that they're struggling. There's a lot of other signs and symptoms, but I think those are some of the most important ones, and some of the ones that often we're able to recognize in others.
Yeah, that's such great advice. That was one of our questions, was along those lines as well. I paraphrased a little bit, so I apologize to our listener if I didn't ask it exactly the way it was phrased. So we have another question here in the chat as well. I'm not quite sure I understand this, so I'll try to do the best I can here. Do you hear from doctors frustrated about some of this confrontation you've been talked about with patients about mask wearing, and if that makes them feel like going into hero mode, or from hero to bad guy? And I think what they're getting at here is, a year and a half ago, we were the heroes, right? We were going to work in the middle of a pandemic when everyone else was staying home, and now suddenly, by recommending evidence-based science with vaccinations and masking and hand washing, we're now suddenly the bad guys. And what it's been like for doctors, especially, to kind of have that whiplash between being hero to bad guy within a very short period of time.
Yeah. I mean, I think it goes back to, what we talked about sort of early on with just how patients are treating physicians, especially most recently. Masking is a huge topic of debate, not amongst physicians, but with the public, and I think it is very, very difficult. I think early on in the pandemic, when physicians were called heroes, most of us were actually very uncomfortable with that. We don't think of ourselves as heroes. We are doing our job. We are doing what we are passionate about. We are helping and taking care of others. That's just what we do, right? And so it was a little hard for us to even put on those capes, right? But I think it was also like, oh, finally some recognition for everything that we do as physicians. I think even, before COVID, there was a lot of frustration with Dr. Google, right? So we've got patients coming in that say, great, I see all of those degrees on your wall, but Google told me, right? And just feeling like our expertise and our education wasn't being respected. And I think this is just a magnification of how that certainly feels. And like you said, some whiplash from being like finally appreciated, and then now I'm the bad guy, right? And that is very, very difficult. And I think it's very difficult for physicians to really manage that, because we're not the bad guys. We're trying to help. We're trying to take care of people. We're trying to follow the rules, right? And to feel like you're being disrespected, disregarded is incredibly hurtful. That doesn't make it any easier to manage, but I think it's important to recognize. I think some of the ways that we can address it is to just talk to each other about it. Like we said before, just sharing, this has been my experience. It's so hard. What did you do? Right. And, I want to put just sort of kind of a final plug there. And this is maybe a little bit more severe than what our watcher was indicating. But, there can be times, especially in the hospital, where patients can get very, very aggressive. And, really, there's a zero tolerance policy for tolerating that type of behavior from patients or their family members. And so if that's happening, I want physicians to know that you can absolutely walk away. You don't have to take it. You can call security. You can call 911 if it reaches that level. But I don't ever want a physician, certainly in my own department, but I'm going to speak for everybody. I never want a physician to feel like they should be abused or threatened or harassed in any capacity, and they 100% should walk away from that behavior and not feel like they have to tolerate it.
Yeah, I've definitely been in some exam rooms before, and when my spidey sense kind of goes up, and we should pay attention to that feeling. I've walked out of some rooms before, not often, and I've been sweared at several times, not often. But I think it's really important that we maintain our own. Don't put ourselves in that position as well too. So this has been such a fantastic discussion. Thank you so much for joining us. We could go on and on and on. Last question. What makes you most proud to be a Permanente physician?
Oh man, that's like the hardest question ever.
You knew it was coming though. Come on.
I know. No, I mean, it's cliche, but it's our people. It's our physicians, right? I am incredibly proud of all of the people that I work with. They are so dedicated. They're dedicated not only to their work and their job, but they're dedicated to, the mission of Permanente medicine. And they're just such a pleasure to work with. We don't just show up to work to take care of patients, although that's definitely our primary job. We show up to work to also work to engage each other, to improve healthcare in general, and to further the health and wellness of our communities. And I don't know how you couldn't be proud of that.
Yeah, I completely agree. Awesome. Well, thank you so much, Dr. Zucker, for joining us. This was great. We'll have to have you back again sometime. I'll just have to have my people call your people and get it set up.
We'll see.
All right. Thanks, everyone. We will see you in 2 weeks. Check your Twitter feed, check your Facebook feed, and like this and share this with your friends as well. Thanks so much.
Thanks, everyone.